Right. Good afternoon, everyone. I am Dr. Jessica Schwenk. I am a DNP or a Doctor of Nursing Practice with focus on family nurse practitioner and acute care adult gero nurse practitioner. Today we're here to have a presentation on the Doctor of Nursing Practice at the School of Nursing at Pacific Lutheran University. Thank you again, everyone, for joining us today. I'm going to give you information and then we'll spend some time opening it up for questions. So first off, I just want to share what programs we do have. Currently, we have two NP programs, the Family Nurse Practitioner and the Psychiatric Mental Health Nurse Practitioner. Both of these also have a certificate program available for someone who is already an advanced practice nurse or is already doctorally prepared. Both of these programs are 3 years full-time and are available as a 4-year part-time program. Looking at our program outcomes, and we're going to revisit those programs in just a minute, but these are our overall program outcomes for the DNP, for the DNP. Looking at the scientific basis, going into the evidence and pulling research out to solve practice problems, using the information technology to support and improve our patient care, whether in the Seattle area or out in our rural and underserved areas. Leadership is key, and of course, moving into an area of specialized nursing practice. The School of Nursing is accredited by the AACN, or American Association of Colleges of Nurses, and also is approved by the Washington State Board of Nursing. All of our programs at PLU are accredited through CCNE, and so through that membership, CCNE accredits for schools of nursing that are members of AACN. We meet all of the requirements for either of the national certification exams for the FNP and the psychiatric mental health nurse practitioner. The DNP is a terminal degree in nursing. It is the highest level of degree that you can get. It is considered equivalent to any other doctorate out there, such as the PhD, the JD, or the Juris Doctorate, which is what our lawyer colleagues get, the DPT, the Doctor of Physical Therapy. These are all considered terminal degrees, and the DNP is one of those. In Washington State, where we are located, nurse practitioners are eligible to work to the full scope of their education and training. We have no requirements to have a collaborative provider or to work alongside someone once we have achieved our degree and our licensure. Completion of the program at PLU makes our students, and therefore graduates, eligible to get licensure as an advanced practice nurse in Washington State. And historically, our board exam rates are consistently over 95%, usually in the 100% range. I wanted to look really quick at our curriculum. Our curriculum, this is the full-time, and this is over 3 years. You can see that we start in summer. We start out kind of slow, foundations of scholarly writing and communication, advanced practice roles and collaboration. Moving into the fall, we have some more challenging courses with the advanced pathophysiology and advanced pharmacology, along with a theory course. J term is our term that's held during the January timeframe. It is 4 weeks. You take a complete course in those 4 weeks. And in the first J term is population health policy and politics. And then you can see in the first spring is when we start to split our cohorts out into family and psychiatric mental health. As you look at the layout, everything that is in red is family nurse practitioner specific, and blue is psychiatric mental health nurse practitioner specific. Everything that is in black, everyone takes together. The cohorted The way we do cohorts is great for getting to know the individuals in your cohort. You will always have a class with those who are in the other population focus. So it's a great opportunity to really start working on that interprofessional collaboration that is wonderful for our patients as we care for them. Clinical placements for our nurse practitioner students are made by our clinical placement coordinator. She is amazing at getting our students placed into areas where they can get the experience that they need in order to achieve the outcomes of the program. All clinical semesters are 120 hours of clinical direct patient care per semester starting in summer of the second year. That goes through the end of your program, and the final semester is a time to really embed yourself into that practice for 240 hours. All told, we are achieving well over the required 750 hours of clinical practice that has been recommended by our accrediting and guiding professional bodies. And in total, you will achieve 1,000 post-baccalaureate clinical and experiential hours, including your clinical placements and your DNP project, which is the graduation requirement. Application requirements, we have a few requirements to make sure that your application makes it through the process. One of those is a statement of goals. How will this program or achieving a DNP as a family or psych mental health nurse practitioner help you to achieve your overall goals for your career? 2 to 3 recommendations. We recommend if you are recently out of school that one of those is academic so that someone can give us some idea of how you will do as a student in a graduate program. If you've been out in the professional space for a period of time, a professional recommendation is recommended. So though that recommendation, I suggest that if you work with an advanced practice provider or a physician, that you have someone who really knows you and is looking forward to working with you as a provider write that. It kind of just gives us an idea that there are people that are out there that know that you would be a good provider. Other documents, a resume or a curriculum vitae, they're basically the same thing. The curriculum vitae is just a little bit deeper into some more of your history as a scholar or as someone who gives service to the community. Transcripts from any and all programs you've ever attended, even if it was just one class of prerequisites. Unofficial transcripts are okay, but if you are offered admission, we will need to get an official transcript eventually to get you into our system. A background check will be completed after admission, and this is required for starting clinical rotations. Our application deadlines are, first priority deadline is December 1st. That's just under a month away. Our second priority deadline is January 15th. Interviews are offered based on the application timeline. We do want to meet our potential students and make sure that they know what they're getting into and how our program will work. Applications submitted will be reviewed on a rolling basis, and our students start generally in summer, the very first week of June. And sometimes this last year, in fact, we started the very last day of May, just because of the timeline of the academic calendar. But it is usually the very first week of June. The postmasters to DNP applicants could start in summer, fall, or spring. That's going to be based on a gap analysis of your previous coursework. And Alex can put a link to where you can input your gap analysis if you have taken any graduate level courses that meet or appear to be similar to those courses that are at PLU. And I would be the one who reviews those, and we'll get back to you and let you know what courses you'd be required to take. Students are required to take all of the classes in the population focus in order to move forward as an FNP or a psych mental health NP. Our cost per semester credit hour is $1,230. We have done some comparisons amongst our peer institutions throughout our area, and this seems to be very in line with what the different organizations are charging. Total tuition, due to the number of credits, Psych Mental Health NP have 4 additional credits on top of what the FNP have. So it's right around $98,000 to $103,000. There are some program fees that are spread across the entire program, and it depends on how many semesters you take for the total amount of those, but they will range somewhere between $6,000 and $8,000. And additional fees that are charged by the university are included on there, and there is, of course, different books and materials that you need to acquire for many of the courses. In order to pay for school, the question that we always get is, how can I get some extra money? You would be asked to fill out the FAFSA regardless of what source you are using in order to pay for your education, so that we can have that information within the university. There may be some programs and grants that may be offered by financial aid. That goes through our student financial services, and you can reach out to them for more information. Anyone who is an alum of PLU, there is a scholarship available for you to welcome you back as a returning LUT. There are other organizations that offer tuition or loan repayment opportunities. The National Health Service Corps, the HRSA Nurse Corps, U.S. Army Nurse Corps, and the Washington Health Professionals Loan Repayment Program are just some examples. This is not all encompassing. There are often many other scholarships available out there that you can take advantage of. Some are smaller. Many people do not apply for the smaller scholarships because they don't know if they're worth their time, but we've had people get awards of $500 or $1,000, and that just helps to go towards your cost of living while you're in grad school. I'm going to open up for questions here in just a minute, but wanted to give you some contact information. Alex is our graduate admission guru. She is amazing, and she is accessible by that email, gradadmission@plu.edu. She communicates with most all of our applicants and will help you to know what is still needed for the program and for the application. If you have any questions, she's your first stop and she will route it appropriately. If you have anything specific about the program itself, or just want to know more about being a nurse practitioner or coming to a doctoral program, you can always reach out to me. My email is there, schwinjl@plu.edu. I am the director of our graduate programs, and I am more than happy to answer your questions or also direct them appropriately for answers. We have quite a bit of time to answer questions for you here today. So I'm going to open up to that. And as you're thinking of those questions and putting them into the chat, I can tell you a little bit more about the programs and how we've ended up to where we are today. We've had an FNP program since the mid-90s. And we started our psychiatric mental health nurse practitioner program in 2016. Actually, 2017, I believe, is when we had our first group come in and start the program. This program itself has been a doctoral program since the teens, and we have graduated many students throughout our area. Many of our alums are available as preceptors to our students. They are great preceptors. They've been through the PLU program. They have gone through it, and they know the challenges and the benefits of going through the program, and can help you along with that. A lot of great mentorship is available through that program. Let's see here. We have a couple of questions. Let's see here. How can I find out the schedule for the part-time option? Great question. So what we do for the part-time option is we take the first year of classes and we'll split that into two. It allows our students to come in at a little bit slower pace. You can start out and we'll work with you on which classes to take. All right, next question. If I have a willing preceptor in my specialty focus, can I work with them? That's a great question. So it depends. That would be my answer. The preceptors that are out there, we do have many students who um, help to choose different places to take their preceptorship. However, we want you to get some great experience throughout the population. The FNP is the full population from birth through geriatric and death. And so a lot of FNPs will work in that, but some are focused more on pediatrics. Some are focused more on women's health. Some are focused more on geriatrics. So we do spread you out. You wouldn't complete all of your hours there, but we could definitely work with you to make sure that we have a contract with that clinic and that preceptor is willing to take a PLU student and then get you placed there. The only requirements are that preceptors cannot be a member of your family or a close friend. The next question is, do we get to choose our doctoral project or is the focus assigned? As of right now, we are allowing students to choose the focus of their doctoral project. The goal of the doctoral project is to be outcomes based, looking to implement something to change the outcomes for our patients, either by helping our providers that we work with to take on a new method of doing something, or having our patients and teaching them to do something new, but it's outcomes based in a primary care situation. So we don't have you implement something in your current workspace. We want you to implement something in a primary care workspace, but your focus can be chosen by you if you don't know what you're going to do or want to do. I work very hard to find different opportunities for folks to do their projects. All right, after the first year, what is the weekly hours commitment, including clinical hours? So after the first year, you're going into your clinical rotations starting in the summer. The clinical rotations are 120 hours until the final semester. The final semester, you have to do those 240 hours. So it depends on when your preceptor works. If your preceptor works 10 or 12-hour shifts, you might just do one day a week, and that will get you all of your hours. If they work 8-hour shifts, you may need to work with them to maybe work 1 or 2 days a week for a few of the weeks to get all of those clinical hours. We're also open to doing some compression of those clinical hours as long as they're not all within about 2 weeks. We want you to be able to spread that learning across the semester, but there are some clinical opportunities, some wonderful clinical opportunities, but they are at a distance. So sometimes our students will go to those distance clinical sites like in Odessa or in Squim, and they will stay there for a few days or for a week and get a lot of their clinical hours done in that period of time. After the first year, all of our classes are held in a single day, so you won't be asked to come into PLU more than 1 day a week. During the first year of classes, classes are typically 1.5 days a week because some of them are pretty in-depth, like the patho, pharm, and physical assessment classes. So we don't want to put too much on you in 1 day. I think taking a patho class, a pharm class, and a theory class all in 1 day can be quite overwhelming. See here, next question. Is it possible to be remote for class sometimes? So yes and no. There are some classes that do require for you to be in person. Those definitely include our physical assessment class, the procedures class. A lot of our didactic courses are in person for our population focus, but sometimes some of the classes are remote. If you were to travel to a distant site to do clinical rotations, then we don't expect you to drive back for class and then drive back out to the remote location. So those ones will often be accessible via Zoom. Our professors are very open to allowing students to sign in if they are ill or have a family emergency. But a lot of our courses are designed so that we can see our students in person. We really think that connection is important so that we can get to know everyone and get the cohort to really get to know each other. Thank you all so much for joining us. I love to see names that we hope to see again as we're moving through into the future. Want to know what the likelihood that we can get through this program while also doing a residency as a BSN grad. I would say that is not something we have tried. We haven't had any students who have tried that. Most of our classes are held on a day to a day and a half a week. It really would depend on the days of the residency. Yeah, this is something where we'd really have to discuss what your goals are, what's your plans as a nurse or as a nurse practitioner, and going through the residency versus just coming into the program and moving ahead in the nurse practitioner specialty. I'd like to again thank you all for coming in today and joining us for this presentation. And please reach out if anyone has any questions at any time. We love to meet people who want to be part of our Lute family or returning to our Lute family. So please reach out early and often. And then thank you again, everyone, for coming. And I hope to see you in the summer.